Many patients would not even step out in the sun, or like even working from home, and they get so much of pigmentation. And they keep asking the doctor to बाहर भी नहीं जाने को कि कैसे pigmentation होता है. It is initially we had fear and proper protection from the UV rays. Nowadays we have a big problem with all these LED lights around. LED lights on the head, LED light on the top, the mobile screen, the laptop screen, all these can cause pigmentation in your skin. So sunscreen is something that is to be used by all age groups. After 6 months of age, even for the kids, you can start using sunscreen. So most people know sunscreen. Depending upon the skin type, again, we can select what kind of sunscreen we want. There is a niacinamide serum. Niacinamide serum is a very good one when it comes to acne. No oil proteins. And reduce intake of dairy products like I told you. Flour and milk is not something that is to allow for people who are having acne. Regular exercise, we can believe that when the metabolism of the body improves, the acne goes down. So these are some handful tips for you to take care of acne. Like I told you, some product recommendations for you. We have sunscreen, yes, that is because the sunscreen has a face wash. Next to it is niacinamide serum. This will help you to get rid of acne. And then there is gel-based moisturizer. This is from Bioderma, a very good decent brand that will help you with your acne. And acne-easy gel, which is sunscreen again. So people with acne can use these products safely and you will definitely notice a decrease in your acne. What are the ingredient treatments for acne or acne scars that you will do? First is PRP for the face. PRP is salicylic protein. So we draw the blood, like how to give your blood sample for testing. We draw the blood and then we PRP out of it. So depending upon which area you are having acne scars or which acne, we can treat that area. That is not very simply that is there is called as scarring laser beam. This is a very Instagram famous treatment where you see the other black kind of paint. It is not a paint, it is a carbon paste that we apply onto the face and then we target it with an infrared laser. That is how the oil and the serum is taken away by the carbon particles and you see a result. Next is PRP for the face. PRP can be inject the pigmented protein in your skin and you see an improvement. Now many patients who ask, "Ma'am, how many sessions will I see the improvement?" See, again depends on the severity of the problem. If the scars are very superficial, you will start appreciating the results in 4 sessions. But if these scars are deep-rooted, then at least 8 to 9 sessions will be needed. It all depends upon need and supply. It is not like every day we need 9 sessions or every day we need only 3 sessions. So we need to keep that in mind. Okay? So next is back acne. Again, this is a very common problem in females, especially for people who like to wear the deep necks. Back acne, nobody likes it, nobody like that. So a very common reason to develop back acne is dandruff. When the scalp is urea is very useful. Our petroleum jelly, Vaseline also helps. If you keep it overnight, put a nice layer of petroleum jelly on your flat heels and then cover it with socks. Even that gives a wonderful result. But some people do not like, this jelly सस्ता मिलता है. So for them, these product recommendations would help. It's anti-aging. Okay, so all of us want to stay young for a long, long time.
color. We belong to Fitzpatrick's 4, 5, 6, a typical Indian skin which does not burn in sun and other tan. Okay, so we need to know how we can better know our skin and get better with how we can take the good care of our skin. So we can have dry skin, oily skin, combination skin, and also very sensitive skin. So you yourself need to analyze what skin type you fall under and how you can take the best care out of yourself. Okay. So when I say how can you take care of your skin, I don't recommend everyone to go to a cosmetology, trichologist, or a cosmetic surgeon and get the opinion of how the skin is. Understand it yourself. Like you tell me, you'll work about 8 to 9 hours a day just under the dental lamp, which is constantly giving you light, and under the mask, which is something you change at least just twice a day. So how much, and then head cap also. See, there are few people sitting with the head cap today. So there are things that you need to know by yourself, that you need to stop following few things. Okay, so first is to follow a thorough skincare. As ma'am rightly said that we have to use moisturizer, we have to use sunscreen. But for that, first thing first, clean your face. Every 6 hours, just wash your face. That is more than enough. Clean it with a cleanser and then use moisturizer and sunscreen just as a topper. Have good hydration. In the 8 hours that you spend in the college, how much do you hydrate yourself? Barely anything. Right? You tell patients you hydrate yourself, your skin will look good. You should hydrate yourself first, right? Then sun protection, of course, you feel that you're sitting in the classroom, no sun is damaging you, nothing. It's not like that. Even the air here has a lot of pollutants. So sunscreen not only protects you from the sun, but also forms a physical barrier which will not let the external toxins sit on your skin and damage it. Okay, so basic, all these things. Now I'm telling you out of 100 people sitting here, 70 people I'm sure would be using unbranded products. Using just like, ये मिल रहा है market में, ये मिल रहा है online, just take it. Don't go for those, okay? Because they are not made as per your skin type. They are made in bulk. And not only for Indians, but all over the world. So you can imagine which skin they don't know, but they're selling the product just because it is applicable for all skin. It's not the fact, okay? So stop using those unbranded products. If you're not sure about what to use, you can always consult a cosmetologist and get an idea of what your skin is and which product will suit you the best. Then as I mentioned about acne and acne scars, we have a lot of maybe females as well as males who have these acne issues. Ma'am rightly said we can use a lot of topical creams, then PRPs, microneedling, laser toning, chemical peel, lot of things. But truly saying again, cleaning your face is the way out. Keeping your head clean is the way out. Make sure you don't have dandruff, you don't have a lot of oily skin. Okay? Don't have a habit of having shower in very hot water, because the more you have it in hot water, the more sebum, that is the sweat of your body, will release, and eventually you will have issues with your skin. Okay? So it's always better to not treat acne by yourself, rather go to an expert and know what grade of acne you have and how can you get better with it. Okay, acne are one thing which will leave you with scars. So do not keep picking your acne. That's very bad, and also do not ignore it. Because until unless you don't go to the roots of acne and treat it, it's not going to go, plus it's going to leave a scar for you. Acne especially, you would be wondering, oh my god, every time I go for a party and I get a pimple on my face, why is that? Don't think that the acne knows that you're going for a party. Rather, they know that your menstrual cycle is near, right? Basically, estrogen, progesterone is going to follow before maybe 7 days of your menstruation. So it's bound to have some hormonal changes that you can get those acne. Okay, so what do we do to treat it? Is make sure you rule out PCOS, PCOM from the body. Insulin resistance, don't have a lot of sugar, keep your weight maintained, and make sure that you eat healthy. So all of this have antioxidants which will not lead to acne. So one thing is in your hand blocks rather than sunscreen. Then oxidative stress, of course, a lot of things, semesters by semesters, midterms, prelims, final exam, they keep going. So that stress is not going to go off. What you need to do is put yourself on antioxidants, take the stress because then only you can become a good doctor, right? So that is not an excuse that I will not study. So take out the stress, at the same time take some supplements which will reduce your stress. Then talking about hormonal imbalancing, make sure that your PCOS, PCOD is ruled out. How can you actually find out? Is one, you will get a larger abdominal wall. You will have a lot of fat pattern around your abdomen. You will have some facial hair. And you might have some darkening of the skin. Okay, these are your very early signs of having PCOS. Okay, so then don't use wrong products. People give steroids for melasma for longer duration. It's not correct because more of steroids can make your skin hyperpigmented or hypopigmented. Steroids in and around is bad. Then insufficient skincare, lack of skincare, again the same thing. If you don't use sunblock, sunscreen, your skin is going to get damaged. And aging, because of aging is something it's not in your hand. So as soon as your elastin and collagen falls down, your hyperpigmentation chances also increases. So what you can do is visit a doctor if you have those hyperpigmented marks, because if you haven't treated at an early stage, use topical creams. Also one thing I would say, hydroquinone, which has been used so widely in melasma, I feel, and my knowledge so far says that hydroquinone used for a very long time causes something called as ochronosis, that is yellowish brown deposits under your skin, which is going to make your melasma look worse. So try avoiding hydroquinone. Go for topical products, and that will not self-recommended, not Google recommended. Okay, go to a cosmetologist, cosmetic surgeon, and get yourself treated with the topical as well as systemic. So this is a study done by me and my dear friend and senior, Dr. Aishwarya Gangane. She both have done a study on about 20 individuals in Indian face type and for melasma, and this has been published in the American Journal of Cosmetic Surgery and has been widely accepted protocol worldwide. So this is a different protocol that we follow for melasma, wherein we infuse along with laser and microneedling, peels and other things, we use tranexamic acid. You will be aware of tranexamic acid because we use it for hemostasis, for any surgical procedures or in clinical extractions, right? So it's an anti-inflammatory and has been used very much in the treatment of melasma. You can use it topically, intradermally, as well as you can use it orally. So we have done this study where we used 250 milligrams of tranexamic twice a day and along with other topical therapies. But one thing that we have introduced is melatonin. What is melatonin? It's a hormone that is produced by our body at night. So have you wondered that why day and night can play a major role in your life? And at night, if you have a habit of staying awake and sleeping at the day, what happens is your body is not in a rest phase. Your pineal glands, which are present, they will not produce a hormone called as melatonin. Melatonin is important because that regulates your melanocyte. If you don't let this hormone start activating, what happens is more and more amount of hypopigmentation will happen. So melatonin is one of the drugs that has shifted the paradigm of the treatment of melasma. So this is 3 milligram drug, you all can have it, but again not recommended until unless you visit and consult yourself. Then talking about scars and keloids, everyone would have some sort of scar. Again, each scar is different. The keloids are the most ugly looking thing that you can see on your body, and you should get yourself treated with that with inflammation and steroids. Whereas scar is basic scars, you have a lot many therapies like scar lightening creams, PRP, scar revision, surgeries and lasers and course. But I feel few scars are good, let them be, because it's better not touch them if it is near those sensitive areas like eyes. But the other scar is what you can get rid of. So you should know which scar to touch, which not. Talking about the hair loss. Hair loss is something every girl is going to face from the age of 25. I am not saying this just because of the hormones, but also because of the activities that girls have started inculcating you should be knowing that smoking and alcohol has long and worse side effects ever. If you think your hair is losing because of hormones and you still keep drinking and smoking, no dear, it's going to make your life worse. You are going to age fast. Okay, so you need to know what is good and what is bad. Then again, basic therapies are there. You have PRP, stem cell therapies, hair transplantation therapy. So don't wait for getting a hair transplantation done on yourself. Better address it at the early stage of life because sometimes hair loss is also genetic. Again, look at your mom and dad. If they have a tendency of having loose hair and losing it very early stage, start your treatments as early as possible. Then you have tattoo removal. Everyone would have regretted at one or the other tattoo that they have put in their life. And maybe some girlfriend's name, boyfriend's name, and they are regretting. So these people are the ones who badly want to remove their tattoo. So those tattoos can be removed with the help of lasers. Again, don't go to any random clinic and get it out just because they have a laser. Because these pigments are seated very deep in the body. They should be knowing that how lasers work and to what level, and then get yourself treated. Lasers are the only way you can remove the tattoo. Okay? Then this is one thing that I would recommend is glutathione. Have you heard patients or oncosurgeries with patients who do many mandibulectomy, rescue or radiation therapy, chemotherapy? You wouldn't know until and unless you go in the chemotherapy department that they are giving some drug called as glutathione. Glutathione is one drug which was introduced to clear the side effects of chemotherapy. This glutathione drug overall helps as an antioxidant and clears and lightens your skin. This was practiced in East Asian countries for lightening their skin, and now India is booming with that. Every actor you would see is going with glutathione IV. Just making their skin lighter and lighter. You might be wondering, what do they do? Do they put makeup all over their body? No, that's glutathione that works. Glutathione is something which is temporary. The moment you stop addressing glutathione in your body, your skin is going to get back to normal. So it does not change your skin type, it just lightens it by 1 to 2 shades, I would say. Okay, so you can go for glutathione. It is very safe. You can start from the age of 25, all good. Each one in their life once should go for glutathione because you will see the results are wonderful. You will see your hands and feet lightening and you'll be like, oh my god, it's great. So everyone wants that baby skin, Korean skin and all, so you might get it with a little bit of glutathione in your body. If not IV, oral absorption is a little less. But you can surely go for IV because it is safe. Talking about what is understanding is what is good and what is bad in your body. Of course, weight gain is bad. Okay, taking too much stress is going to put you into more eating habits. I know, like if you're stressing up for your exams, you'll understand this before your exam you start gaining weight. That's very obvious. So make sure you have control on your diet. Second thing, again, alcohol, smoking, please avoid. And third is eat good food. Most of you all would seem to be staying somewhere nearby in the residency, not from traveling, not from home. So for these people, of course, you really need to look at what you're eating. Okay, if not anything, at least eat some dry foods like walnut, eggs, which is biotin, and spinach, vitamin A rich food. It will help you age a little slower. So do not compromise on what you eat. Talking about other things, again, don't use unbranded products and please have a health checkup. Okay, this is very important for each and every girl sitting here that every once in a year or maybe once in 2 years you go for a health checkup where you see at least your sugar, do your mammography and check your uterus. This is really, really, really important. Do not PCOS, PCOM from your body and take a human papillomavirus injection because from the age of 18, once you get sexually active, it is really, really difficult to know what viruses hang around in your body. So if cervical cancer is increasing day by day, so you have to make sure that you're vaccinated for the same. If you haven't had one right now, I would suggest go visit your gynecologist and get those free vaccines. Okay? Then you should know your even if you have it in your curriculum as a hair transplantation surgery, don't start with it because now the rules are so strict that it has to be done by a surgeon and has to be certified for doing it. Should have a minor OT setup in the hospital where they're working and should have the emergency services near and around you. So just think before you start doing hair transplant after 3 days. You can do it under a surgeon's guidance. Okay. Then now we will quickly go on to the other things, that is double chin reduction, because it's very important to reduce your fat which is under your chin, your liposuctions and everything